All right, well, wonderful. Well, thank you so much for your interest in the Hawaii Health Connector. What I'm going to do is just try to give you a good overview of who we are. There are some experts in the room that could probably do this presentation for me, but I look forward to just giving you a sense of what our priorities are as we work toward October the 1st. So the Hawaii Health Connector's priority is serving as a channel to implement the Affordable Care Act's requirement to establish health insurance exchanges in every state. The ACA passed in 2010, and it's a very broad law. Within that is Section 1311, which is where the health insurance exchange activity resides. So I'm not going to be presenting today about the Affordable Care Act overall. Many provisions began being implemented in 2010, and around Hawaii you'll hear about those through the Healthcare Transformation Coordinator that resides in the Governor's office. Our focus and priority, though, again, is in Section 1311 of the Affordable Care Act. So in order for states to establish a health insurance exchange, they really needed two key statutory authorities. One is the federal authority, which again was accomplished in passing this law in 2010. The second is for state statute to give authority for the insurance exchange to be implemented, and within that statute, the prescription about the governance authority or the governance model that was going to be used to oversee the body also had to be included, and so that's what was accomplished in Act 205. Act 205 passed in July 2011. At that time, the Department of Commerce and Consumer Affairs began implementing the provisions of Act 205, and I was hired in December 2011 and began establishing the Hawaii Health Connector, which is a nonprofit organization. States are choosing options and structures and how they want to establish their state-based exchanges. There are three different types of exchange options for states. You'll hear about federally facilitated exchanges. Those are states that maybe just decide that they want to default to whatever the feds are providing, so it's more of a turnkey option. There are different reasons why states make those choices. At the national level, the debate around the Affordable Care Act continues to be vigorously discussed, and so for some states, maybe there isn't the political desire to, establish an exchange. For Hawaii, though, because of the Prepaid Health Care Act, within the Affordable Care Act, there was something called a rule of construction that ensured that the Prepaid Health Care Act remained intact while the provisions of the Affordable Care Act were being implemented, and that's definitely something that we've had to incorporate in the way that the exchange is being established here in Hawaii, because we've had to blend the two laws. So we're establishing a state-based exchange, and that's one of the three options that states have. So federally facilitated is one, state-based exchange is another, and a partnership model is a third option. And I just sort of described partnership as leveraging kind of the best of both, but maybe the states that decided to take that option, they didn't start early enough in the process to afford themselves the ability to have enough runway to get a state-based exchange up and running by October the 1st. So Hawaii is a state-based exchange. We're a nonprofit. We were established by the legislature. We have a board of directors, 15 members, who were nominated by the governor and confirmed by the Senate, 4 of whom are representatives of departments within the state. They include Department of Commerce and Consumer Affairs, Department of Human Services, because we're integrated with the Medicaid eligibility and enrollment system within our IT architecture of the exchange, so very closely linked